Hi, welcome back. I'm Dr. Hawkins, and this is a series of 15 sessions in pain management. After each of the sessions, I'd like for you to listen to the relaxation that's also on this DVD that you've got. There are several of them, and I'd like for you to listen to each one of them and pick one or two that really seems to fit with you and begin to listen to them more often. You don't have to wait. And listen to them after every session. I'd like for you to after every session. But I also would like for you to listen to them between sessions too, 2 times a day. Because relaxing means letting go of all of that tension out of every muscle group in your body. And relaxation is one of the building blocks of pain management. It's one of the things that we're going to be teaching in all those 15 sessions is really 2 truths. And the first one is learning to tell the brain the truth about the world, about you. And the other one is learning to tell the brain what you want it to do. And it'll do it. It can happen. And relaxation is a very important part of getting your body to the point that the brain understands what you want. Now, a lot of you have had pain for a number of years. You know, in Oklahoma City, my clinic, the average pain patient coming in is probably 2 years of pain. So you've been through a lot. And you have a lot of experiences, some successful, but not all, or you wouldn't be listening to this tape. So I'm encouraging you to sit back. You don't have to take any notes. I want you to listen to what I'm saying in these 15 sessions. Get as much out as you can, and practice that. Practice it every day. Think about it and listen to the tapes. You know, I have, in my experience in groups, there's people who have come all the way through and done the whole 15 sessions, and they leave without any pain whatsoever. Very few of them. Then there are some who come, do the whole 15 sessions, and they may leave without any change whatsoever. Maybe even worse. There's very few of them. But the vast majority of people get something from these groups. And what they get is dependent upon some things that are not in their control, like how their body is, their constitution. But mostly what they get out of it is what they put in it, and how hard they work and how much they practice. And I encourage you to practice these techniques. Keep an open mind. And get out of it all that you want to get out of. And so sit back and listen to what we're talking about here. And one of the things that everyone in pain management or in pain has to deal with is the issue of whether or not their pain is in their head. You know, you've run into it, whether you've gone to your doctor or your family doctor and your Aunt Minnie and Uncle Fudd or your boss thinks that your pain is in your head. You know, when the doctor comes in and says, you know, that x-ray of your surgery, that looks great. That the fusion is really good. And you still have pain. It doesn't mean that the pain is in your head. Or maybe they do test after test and they can't figure out where your pain is and what's causing your pain. That doesn't mean the pain is in your head. You know, there was a study done not long ago about people who had car accidents, collisions, and those who were making medical claims for whiplash. And they studied the severity of the car crash, what actually happened, you know, fenders or whatever was broken up. They studied the actual damages done to the body. They studied what the person was like before they had the accident and what they were like afterwards. And out of all of that, what they found was that the whiplash or the pain had nothing to do with the severity of that accident. What it had to do with was about 4 variables. The first one was what their physical condition was before they had an accident. The other one was, before the accident, how often they went to doctors. Another one was how much time they spent thinking about what's going on in their body. Now that big term is called somatization. And the other one is their perceived injury, how severe they think their injury was at the time of the accident. And so what you got here is not just a physical injury, you see. What really determined whether a person is going to be having problem with whiplash was not only some physical damage, most likely, but it had to do with fears. You know, how often did they go to doctors in the first place, which indicated some fears? Their belief system. You know, if you believe that you're injured, chances are you're going to feel it. You're going to have more pain. If you believe you're in a bad pain condition, chances are you're going to be in a bad pain condition. And the other one is how much time and energy, in other words, how much energy they spend and devote to their pain. You know, it's kind of like making pain your centerpiece of your life. When pain is the centerpiece of your life and everything is determined by this centerpiece, you know, you're going to have more pain. It's got more power. Now, the other thing that pain patients run into is the issue of addiction. Somebody thinks that you have taken too many meds. And that's something that really needs to get off your plate. You need to get that real clear so that you don't have to worry about that. Again, learning to tell your brain the truth. Well, you need to tell the brain. Are you addicted or are you not? Are you taking too many meds or are you not? Now, one of the things that confuses the issues of addiction is a concept called tolerance. And about 25% of people have to go up on their meds because their body adjusts to the meds that they're taking. And so to get the same amount of pain relief, they have to increase the dosage. Now that's not addiction. That's biochemical. That's your body using it up and not being able to make as much use of it as it did before. Then there's an issue of physical dependence. Now, physical dependence means that if you stop the meds, you're going to have a withdrawal. Now, having withdrawal doesn't mean you're addicted. Some of you may have blood pressure medicine, beta blockers. And if you're on a beta blocker, you can't stop your medicine because you're going to withdraw. Or some of you may be taking steroids. You can't stop steroids without some withdrawal. That doesn't mean you're addicted. That means your body has adjusted to it and now it needs it. Now, you can be addicted without a physical dependence. You can have physical dependence without addiction. Addiction is a disease. You're going to take that medicine, whether it kills you or not. You're going to take the medicine whether it ruins your relationships, ruins your body, gets you to lose your doctor, or you're going to travel from doctor to doctor trying to find more meds. You're going to go to ER room more often. Most likely, you're going to have those who have a high chance of becoming addicted is going to have a family history of addiction. Now, most of us do. But a lot of people have a history of addiction within their own life. Another sign of addiction would be if your family gets concerned that you look intoxicated. Now, that's on a long-term basis. Of course, you're going to feel the effects of an increase in your medicine. You know, that you're going to feel a little drowsy. You're going to slur your words after your medicine has been increased. But over a period of time, you shouldn't be feeling and looking as if you're intoxicated. If you fall in one or two of those, that still doesn't make you addicted. I encourage you to get this off your plate. Go talk to your doctor about it. Tell him of the history of your family or your history. The doctor has the Department of or the Drug Enforcement Agency looking over his or her shoulder all the time. And he would love to have a partner in figuring out a proper regime of medicine for you. So if you go in and you talk to him about, you want to know about your medicine, whether you're taking enough, whether you're not taking enough, how you're taking it, he would like to have that kind of a partner. I don't know of any doctor, that would cut your medicine off because you bring that issue up. Although that's a scary thing for a lot of people. But don't be frightened of that. Just go talk with your doctor about it. The other thing is, myth is that if it hurts, stop it. You see, that's only good for acute pain. For chronic pain means you're going to have persistent pain. And to get up in the morning and have some pain doesn't mean you got to stay in bed all day. And there's nothing I'm going to be saying here that ever suggests that you ought to get in a rocking chair. I want you to be productive. I want at the end of this that you are able to do things without increasing your pain. And so just because you have pain is not a sign that you need to shut it down. It's a sign of a signal, actually, of management, that brings to mind, I've got to manage this pain. I've got to do things to get through this episode and get things done, whatever the task should be. A success, you see, in the past was you get it done, and you get it done as fast as you can, and now you're done, no matter what it happens to you. And now success is finishing a task and doing it in a way through resting and activity, where at the end of it, that evening, and particularly the next morning, you're not hurting anymore than you usually do. And that is so important that when that happens, you need to get you like a calendar, one of those bank calendars with big, the big boxes on it. So you can stick a sticker up there of a star or put an X in there so you can kind of follow your improvement, because that's a major deal for us pain patients. The other myth is pain is a thing. Now, if pain was a thing, the doctors could take a picture of it out here and they could see it. If pain was a thing, it wouldn't be moving around. It wouldn't be in this shoulder and then go down to that hip. If pain was a thing, it would be the same all the time. You know that that's not so. Your pain is up one day and maybe down another. What we find with weather, even before you got injured or came down with this condition, you may remember getting up in the morning and you just didn't feel good, even before you had pain. Joints didn't feel you down, kind of a blah day, physically, emotionally. And so sometimes when your pain goes up, it may be in one of those cycles. It may not be a sign that there's something different. If pain was a thing, you would be feeling it the same all the time. Doctors would be able to see it on an X-ray or on the MRI. If pain was a thing, it would move around. If we had a pain in our hand, then we could just cut that hand off and that'd take care of the pain. But it doesn't. There's people that have hands that are cut off that their hand's gone, but they still have pain there. Because, as we talked about a little bit ago, pain is a matter of a person's beliefs, what they're thinking, psychological stuff, as well as structural damage. and biochemical changes. It's the whole ball of wax that determines pain. So that's why soldiers bringing their buddy back to the medic, carrying them back, and they only to find out that he was hurt worse than the guy he was carrying in. If pain was a thing, he would have felt that pain as he brought the buddy in. If pain was a thing, you see, you would feel it too. And you've had the experience of being in the kitchen, or you've been out in the garage, and all of a sudden you start seeing this blood, and you looking around till you see the cut, and you didn't feel it till you see the cut. If pain was a thing, you see, you would feel it when it happened. But you didn't feel it, for one thing, is your attention was someplace else. The last myth is that pain is equal to injury, and that's just not so. Different people experience pain in different ways. If we took, let's say at Walmart, we took the first 10 people that came in there that didn't have pain, and we gave them MRIs, chances are that we're going to find some of those people with bone spurs and herniations, and they don't have any pain. To compare one person to another based on the amount of injury in their back, their neck, or wherever, does no good in terms of determining pain, because it's not the amount of injury. Remember the story about the whiplash issues? There's more than one thing. It's a whole ball of wax here. It is the psychological as well as the structural, as well as the biochemical. Now, we don't have any control about what actually is going on in the structural damage, but we do have control of what I call is going on beneath the bone, what the psychological issues are. And we can make some changes even in the biochemical things. You can enjoy life again. If nothing changes, nothing changes. This is Dr. Hawkins. This ends our session in pain management. I want you to have a great day. Practice the relaxation. Think about what we've talked about. And I will see you next time.